privileged to be asked to come up to Chicago earlier in the year and talk to the student neuro group there. The weekend that I went up there actually overlapped with COVD. They were a little concerned that, they wouldn't have a big turnout, but we had a very good turnout. And I got tremendous feedback from the students there. So Carl asked if I'd be willing to present a little bit here. Now, you aren't all students, but part of this is, well, for everyone who's here, I guess this is very important to all of us. But to me, this is my life. This is what I am. This is what I do. But I couldn't be too much more enthusiastic. And even though this is the very end of a very long week, I haven't faded yet because I really think that this is important. What all of us do, everybody in this room is equally important. Whether you're a lecturer, whether you're a provider, whether you're a doctor who's just learning this, whether you're a student who's just learning about it, every single one of us is equally important because all of us will contribute in a meaningful way to the care of our patients. For some of us it will be directly, some less directly, but everyone here makes a difference. Now, when I'm talking to students, but I've also got doctors here who may do a little bit of rehab or interested in doing a little bit of rehab. Let me start by telling you why I am doing this. I've been in practice for 37 years. I see on average 20, probably it's closer to 30 new neurocompromised patients a week. When I wrote this, I really was kind of doing it on the fly. I see about 20 new stroke patients a week. That doesn't count everything else that I see. So all doctors are going to see these types of patients, but a lot of them just don't understand the patient's problems. The average optometrist or ophthalmologist is treating eyes. They're not treating the patient. And they don't necessarily understand the impact that vision has on their patients. You need to know and understand neuro-optometry whether you're a provider or not. Because for the general optometrist, as the public starts demanding this level of care, they're going to find themselves in trouble if they cannot refer for appropriate care. So starting out with, what is vision? We've got some easy people we can quote on that, and I knew Bob Kraskin for, well, my whole life until he died. He was Uncle Bob. Not a blood relative, but since we practiced in the area and Jeff and I grew up as optometrist kids, this was part of the optometric family. So vision, this is not an easy mouthful to get out, but it's very clear. It is the deriving of meaning and the directing of action as a product of the processing of information triggered by a select band of radiant energy. And that pretty well describes it, but what's key in there that the general eye doctors do not understand is the meaning and the action. If you take that out, you may have eyesight, you don't have vision. And according to a PhD who isn't an optometrist and doesn't know optometry, the ultimate purpose of the visual process is to arrive at an appropriate motor and or cognitive response. Makes sense to all of us here. So, we start looking at vision and brain injury. There is a greater than 50% incidence of visual and visual cognitive disorders in neurologically impaired patients. These are not optometric figures. Anyone who wants evidence, the evidence is overwhelming, but it's not necessarily coming out of optometry because, speaking for myself, I'm too busy taking care of patients to write research papers. And an OT, visual perceptual dysfunction is one of the most common devastating residual impairments of head injury. If we don't take care of these patients, who will? Now, there are two types of information you have to get from your vision. Can't get it any other way. What things are and where things are. You have some ways of getting some of that information, but that's our job. We need to make sure the patient knows what things are and where things are. And vision disorders will impact the patient's ability to participate in every other rehabilitative therapy. So, what is neuro-optometric rehabilitation? It's the art and science of rehabilitation of the neurologically and cognitively injured and disabled survivor population by recognizing the crucial role of vision in human performance. And it emphasizes treatment modalities designed to optimize the frequently neglected visual motor, visual perceptual, and visual information processing dysfunctions. Now, this is basically in the website, maybe slightly paraphrased. So if you haven't looked at the Neuro website, it's being changed, it's being developed, it's much more sophisticated. The information is very clear. Get it and use it. Now, if you look at functional scales for visually impaired patients, the most commonly used ones, you've got the Bartel Index, you've got NIH, you've got the FMI. These are all visually derived functional abilities. The vast majority of what is being tested in a patient who is impaired is visually based. If not a direct visual skill, it's a motor skill that's based on visual information.